Hi, I'm Patty Cason. I'm a family nurse practitioner with a specialty in sexual and reproductive health. We've put together a series of vignettes for you that are demonstrating patient-centered reproductive goals and contraception counseling skills. The healthcare providers are played by real clinicians, and the patients are played by actors. We have two different sets of vignettes, and in one of them, we stop periodically to tell you which skill we're going to be demonstrating. And in the other one, we play it straight through for your viewing pleasure, just like a movie. We hope you enjoy them. The following videos demonstrate how to operationalize patient-centered counseling about reproductive goals and contraceptive preferences using the PATH framework. This framework is a concrete set of open-ended questions and counseling skills designed to effectively engage with patients about their reproductive goals and, when appropriate, pre-pregnancy care, contraception, and infertility services. PATH is an acronym. The PA stands for Parenting or Pregnancy Attitudes, the T for Timing, and the H for how important it is to prevent pregnancy. PATH asks the following three questions. For the PA, do you think you might like to have children at some point? Or if the person's already had children, do you think you might like to have more children at some point? The T, when do you think that might be? And the H, how important is it to you to prevent pregnancy until then?
Good morning. My name's Cassandra.
Hi.
Nice to meet you. And you're Alyssa?
Yes.
All right, great. Can you go ahead and give me your last name and date of birth?
Yep. It's Peterson and November 13th, 1989.
Okay, great. Thank you so much for waiting. We had a patient earlier this morning that needed some extra time. I hope that this didn't mess up your day too much.
Oh, no, actually it's fine. I had a chance to look at the chart and look some stuff up on my phone. And honestly, it's nice to just take a break from my life for a minute.
Well, I'm just gonna log in here, okay? It'll just take a moment. So tell me about your life. Are you working or in school?
Or both. I work as a server at night, and then I'm a student full-time right now, and I'm actually studying to be ultrasound technician.
Oh, awesome. So you'll be joining us in the wonderful world of healthcare.
Yes.
Welcome.
Thank you.
I've actually heard that that's a great career. But how do you juggle it all, work and school? I mean, you must be quite determined.
More like I've just had a series of crappy jobs since high school, and I don't know, I just need to do this for me.
Okay. Well, I see here that you're here for a well woman visit. Is there anything else that you'd like to talk about today?
No, I think that's it. This is my first PAP, and I am like 100% not looking forward to it. And I know I should have come in a long time ago, but I'm gay and I didn't think that I needed this kind of a test. But then a friend from school told me that I should come in, so.
Okay. Well, your friend is right, and I'm really glad that you decided to come in today. I can see that this isn't easy for you. We can go through each step of the exam so you know what to expect. Is there any part in particular that's concerning you?
Well, it's super embarrassing.
I get that a lot.
And it doesn't hurt too much, right?
You're right. So most folks say that they feel pressure, but that doesn't actually hurt. Okay. Is there anything that you found in the past that makes things like this that might be hard easier?
Just knowing what's going to happen ahead of time and knowing who's going to be doing it.
We can go as slow as you'd like. I can stop at any time. And if you think of anything that I can do to make this easier for you, please let me know.
I will. I think I'll be fine, though.
Part of today's visit is us going through some reproductive health care questions together. Are you okay with that?
Yeah.
Okay, great. Do you think that you might like to have children at some point?
No. Well, yes. I would like to have a kid someday, but I'm hoping that my future partner would be the one to carry the baby. I just don't really see myself enjoying pregnancy.
Okay. And do you know when that might be?
Well, I have to find a girlfriend first, so there's that. But once I'm done with school, I should be able to support a kid, so.
Okay, well, it looks like you've put some thought into this. Now, I don't want to make any assumptions, but I don't know if you ever have sex with anyone with whom you could become pregnant. And if you do, how important is it for you to prevent pregnancy until you finish ultrasound tech school?
Yeah, no, actually, I do. I have a friend, and we both have a little, bedroom rodeo whenever we're both single. But honestly, it wouldn't really be the end of the world if I got pregnant.
Okay, so I'm hearing you say that you'd prefer to prevent pregnancy now. So would you like to talk about options for contraception?
Sure.
Okay. I'm also hearing you say that you don't completely oppose the idea. So if you'd like, we can also talk about ways to become prepared for a healthy pregnancy.
Maybe let's talk about the birth control, because I truly don't actually want to get pregnant.
Okay, fair enough. Do you have any sense of what's important for you in a birth control method?
I was on the pill in high school, and that was great for my skin, so there's that.
You're right. So birth control pills can definitely help with acne. So can the birth control ring and the birth control patch. Anything else that's important for you in a birth control method?
Well, my last girlfriend had really bad periods, and they told her to take the pill to completely stop them. And I mean, mine are okay, but if I had the choice to stop them, I totally would. Every month is just this reminder of what a drag it is to be a female.
I hear you. It sounds like you actually know some of the extra things that you can get from a birth control method. And it also sounds like you're pretty clear on what you want.
Yeah, I look things up, and I mean, even though my school doesn't really focus on these issues, I'm learning how to think about my health and my body in a different way.
So it sounds like your priority is to choose one of these methods here. So to help with acne, we can use the pill, the patch, or the ring. To skip your periods, we can do that safely with either the pill or the ring. Okay. You'll notice here that these methods we're talking about are on the second row of the chart. What that means is they work pretty well, but not as well as the ones here on the top line. Okay, and that just has to do with us being human and how we use them, typical use. Okay, but we can get more close to these effective numbers the more perfectly that we use these methods. Okay, so it sounds like we want something to help with acne, help skip your period, and you're also okay with the level of effectiveness. Do I have that all correct?
Yes.
Great. Now, is there anything else important to you? For instance, if you choose the pill, it's something you'll have to remember to take every day. If you choose the ring, it's something that you'll have to put into your vagina and change once a month. Are you okay with either of those? Do you prefer one over the other?
Well, I use tampons, and as long as the ring doesn't hurt or feel weird in any way, then I would be okay with putting that in. Is one better than the other?
Not necessarily. They're very similar, actually. They both have a mixture of female hormones, estrogen and progesterone. They both actually keep the egg in the ovary here, so it can't leave out here to meet the sperm. Actually, it's just the way that you use them that they're different. How do you think you would do if you had to take a pill every day?
Oh, I'm sure I'd be fine with that, but the ring does seem easier.
Okay. Would you like to go over the details of how to use the ring?
Is there a lot to know?
Not really. Mostly, the instructions that you'll get with the ring are written for somebody that does want to have a scheduled once-a-month bleed, like a period. Since you'd like to skip your periods, what I would recommend is you put the ring in the first day of every month, keep it in for that full month, and on the first day of the next month, take out the old ring and replace it with a new ring.
So it's like paying your rent.
It's exactly like paying your rent, except you actually get to save money on tampons. Would you like to start today?
Sure. Today isn't the first.
You're right. So it's not the first of the month, but it is actually safe to start the ring any day as long as you're not pregnant. Is there any chance that you could be pregnant?
Not unless my sex toys can get me pregnant.
Not the last time that I checked. So you can go ahead and start the ring today if you'd like. You'll have protection once it's been in for 7 days. Each ring has enough hormone in it to give you protection for at least a month. One way to think of it is that each month gets a ring. So this ring would belong to February, next ring would be for March, the next would be for April, and so on. The reason we offer the first of the month way to change it is just because it might be easier for some folks to remember. Okay?
Okay.
What we can do, I can give you a ring today. You can go ahead and put it in, and if you have any questions, I can check it. I can have you put it in right after we're finished with the exam.
Sounds good. I don't think I'll have a problem though.
Okay. I don't think you will either. Some people do notice some bleeding or spotting in the first few months as their body's adjusting to the hormone. If that happens, you can go ahead and take the ring out for 4 days, have a little bleed like a period, and then put the ring back in for the rest of the month. How would you feel about that?
Does that mean that the bleeding would stop after that?
Usually it does, with removing the ring and then putting it back in.
Okay.
Okay. If you do need to do that, it's really important to make sure that you don't leave the ring out for more than 4 days.
Okay. So, on to the fun part.
Yes. Before we get there, Alyssa, I felt that I could give you a ton of information, more than I usually do, but I want to make sure that I didn't leave out anything important that you need to know. So can you please tell me how you plan to use the ring to skip your period?
Hey, good afternoon. I'm Dr. Brian Nguyen. It says here that you're seeing me today for an STD check. The assistant tells me that you're interested in getting tested because you've been with someone new. Are you experiencing any symptoms?
No, I just want to be safe, you know?
You know, testing is a great way to take care of yourself and also to make sure that you're not transmitting anything to a new partner.
I try.
Well, if you're not experiencing any specific symptoms, then I can offer you a urine test for gonorrhea and chlamydia and a blood test for syphilis and HIV. Is there anything else that you wanted to discuss today?
No, not me. But I'm also here with this new girl I've been seeing. She's getting checked out too, and I'm hoping that she gets on birth control too.
It sounds like you're both invested in being healthy. What are you currently doing to prevent pregnancy?
Condoms. But that's why I'm hoping she gets on the birth control. My daughter, Kayla, comes from using condom or from not using a condom.
You know, you're not the first to mention this kind of thing happening. It sounds like you are not ready for another pregnancy, but are you thinking that you might like to have more kids at some point?
No. I'm done. Like, done. I mean, don't get me wrong. I love my children so much, but yeah, I don't want any more kids.
I hear you. So, given that, how important is it to you to prevent pregnancy?
Well, it's very important to me, but most of the birth control is for women. It's not like I can make her use it. It's not my body. If she wants to use birth control or not, it's her body. All I can do is go along with whatever it is she wants to do.
It sounds like you see the importance of honoring the choices of the women that you've been with. And, you know, most of my male patients are frustrated that there aren't more birth control methods for men. And if it were available, I would prescribe you male birth control. But the science just isn't there yet.
Yeah, right. What's up with that?
I think it's like you said, we pay more attention to preventing pregnancy with women than we do with men, not realizing that men care about preventing pregnancy and being prepared for pregnancy too. Drug companies need to know that men want to use male birth control. In the meantime, I do think it's important that guys like yourself know more about women's birth control methods so that they can have a conversation with their partners. It's a couple's issue, not just a woman's issue.
Yeah. I get where you're coming from.
Did you get a chance while you were waiting to take a look at this chart? It shows the different methods of birth control and how well they work to prevent pregnancy. I'd be happy to explain any of them to you.
I saw that, yeah. But as you said, not much for men but condoms and just pulling out.
Well, has anyone ever talked to you about permanent contraception?
No. What's that? Like Birth control forever? No. I mean, unless you mean that thing where they tie guys' tubes.
Well, that's exactly what we're talking about. Vasectomy. It's a very safe and effective procedure that men can use to prevent pregnancy. And you're right. Once you get it, you can forget it. It continues to work for the rest of your life.
That's a good deal. But doesn't that end up taking away a man's cum? And what about a dude's sex drive?
Those are excellent questions. A lot of men worry that vasectomy is going to affect their coming or their sex drive. Fortunately, vasectomy doesn't do either of those things. Or really, what would be the point of using it?
Right.
It actually blocks the sperm from getting into the cum. The way that I explain it, it's all juice, no seeds. So, what other questions do you have for me about vasectomy?
So yeah, we'll do all that testing,
Okay,
and we'll see how it goes.
sounds good.
So, do you think you might like to have children at some point?
I'm really not sure. Probably. I used to think no way, because I've just about been raising my little brothers. But my sister has the cutest baby I've ever seen. So, yeah, probably.
So, how important is it to you to prevent pregnancy?
Really important. My mother would kill me.
And you've said you've been hooking up with Michael, which is why you were here for testing. And I'm just wondering, would now be a good time to talk about contraception?
Yeah, that's part of the other reason why I'm here. While I was waiting, I was looking at this chart. I totally did not know that some types of birth control work really good and others look like a waste of my time.
Yeah. Well, it sounds like one of the things that you're interested in with birth control is that it's really effective at keeping you from getting pregnant until you're ready. Do you have a sense of what else might be important to you about birth control?
I'd really like something that I don't have to think much about because I've got so much going on with school and I have to watch my brothers. And honestly, I'm not that good at remembering stuff.
Welcome to the human race. Nobody's that good at remembering to take, for example, a pill every day. So it sounds like you're looking for something that's really effective and that you can forget about. Do I have that right?
Yeah, that sounds right.
So do you have a sense of what else you might be looking for? For example, some methods can help with things like painful periods or acne. Some methods even help prevent cancer.
I do get super bad cramps when I get my period. Can birth control actually help me with that?
Absolutely, yeah. And some of the methods at the top of this chart can help prevent cramps with your periods. And actually, many people who use them don't get their period at all, or maybe they just get occasional light bleeding or spotting. How would it be for you if you didn't get your period while you were using one of these methods?
I didn't even think that was possible. My abuela told me that it's not healthy not to get my periods, so I don't think that's for me.
Your grandmother's completely right.
My abuela is awesome. We're really tight. I tell her everything.
Well, when you're not using birth control that has hormones in it, it is important for you to get your period regularly.
But what if my birth control does have hormones in it?
That's a great question. And interestingly, so this is a uterus. This is where, if you ever do decide to have a baby, the baby will grow right in here. And this is the lining of the uterus right here. So when you use a method of birth control that has hormones in it, it makes this lining super thin. And there's nothing healthier for a uterine lining than to be thin. It actually helps to prevent cancer. So knowing that, how would it be for you if you didn't get your period while you were using one of those methods?
I think that would be pretty awesome. I really hate my period.
So do you have a sense of what else you might be looking for with birth control?
That's all I can think of. My sister has one of those IUDs. They gave it to her right after she had her little baby. She likes it. I might think about that, but it kind of freaks me out.
Can you tell me a little bit about what freaks you out?
Yeah, my friend said she heard it hurts a lot.
I can see why that would freak you out. So this is what an IUD looks like and feels like. This is not a real IUD, but it looks exactly like one. And the place that it goes is up here in the uterus that we were talking about before. And I would place it into your uterus. And your friend's right, it can cause some cramping and some discomfort. It's kind of like a bad menstrual cramp or bad menstrual cramps. But once it's in and it's in place, you shouldn't have any pain. Does your sister have pain?
No, she never said she did. It's so small and soft. How can something like this keep me from getting pregnant?
I hear that all the time. It actually blocks the sperm from getting into the uterus. The sperm is the stuff in the man's semen that can get you pregnant. So the sperm never meets an egg. So how would you be with all that?
Well, I do have a ton of experience with cramps, so I'd probably be okay. Does this one go up there also?
So that's an implant, and it goes right under the surface of your skin, right here on the inside of your arm. And this is what it feels like. And Sienna, the woman that brought you back, she's actually using an implant, and she loves to show it to people. So if you're interested, I'm sure she would show it to you.
Yeah, that sounds quite interesting.
Also, you said that you're really interested in something that's in the very top tier of effectiveness. And this method, this implant, is actually the most effective method we have. If 1,000 women used it for a year, probably none of them would get pregnant, or maybe one. As compared to, for example, the pill. If 1,000 women used the pill for a year, 70 or 80 of them would be pregnant at the end of the year.
I never heard of this before.
Would you like to hear more about the implant? So most people using it don't get their period at all, or they just have occasional light bleeding or spotting. And you said before that you'd be okay with that. Is that right?
Yes.
Okay. The thing is, we won't be able to predict what your bleeding is going to be like. So most people have not very much bleeding, but we wouldn't know whether or not you were going to bleed or spot. So how would it be for you if you couldn't actually predict?
Wouldn't love that, but I guess I could keep a mini pad handy.
That's a great idea. About 1 in 4 or 1 in 5 women who are using this may have some periods of time where their bleeding is really going on for a long time. It can be really annoying. Have you ever had bleeding that went on for a long time and was annoying?
Yeah, about 6 months after I started getting my period, I bled and bled.
Do you remember how you managed it?
Yeah, they gave me birth control pills and it went away.
That's great you know that, because that's a treatment that we can use if, while you're using the implant, you have bleeding that's annoying to you.
So you're in your 3rd trimester now, and things have been going great, minus this little cold that you've got. Since we're entering the home stretch, it might be a good time to start talking about the future. Do you think that you're going to want to have more children at some point?
We're a big family, and we have so many bills to pay each month. I'm definitely not asking for another child. Mm-hmm. But if he comes, I'm not going to be upset. You have this love for your children, and you've created them. Mm-hmm. You rise to the occasion and don't stop to think about all the bad things.
That's really beautifully put. So, how important would you say it is for you to prevent pregnancy?
It's important to me. But if it happens, I'll be a little shocked. I'll be happy. I'm not going to be mad. I'm not going to be mad at all about it. I'd be happy. No matter what the situation is or whatever, you have to take care of them. It really wouldn't be a big change. Just another baby.
So it sounds like on the one hand, you and your family would adjust if you had a new little one. But on the other hand, you'd ideally want to prevent pregnancy. And medically speaking, it's a good idea to space pregnancies by more than a year and a half or so. So that said, do you think this would be a good time for us to talk about ways that you can prevent pregnancy?
We've been talking about getting my tubes tied, but I'm just not ready for that yet. I breastfeed my kids, and I never get pregnant while I'm doing that.
Well, it's great that you know that breastfeeding is important and great for your kids. And if you're breastfeeding 100% of the time for 6 months, it's a very effective way of preventing pregnancy until your period comes back.
And it's good for losing the baby weight.
Yeah.
I'm truly dedicated to nursing. I tell all my friends about it.
Well, thank you for being such a champion for breastfeeding. Have you given any thought to how you might prevent pregnancy after the baby's 6 months old?
Well, I usually breastfeed longer than that, but yeah, I do get my period after the baby's taking food. So you're saying that nursing won't protect me once I get my period again?
That's exactly right. So breastfeeding is telling your body that the ovary shouldn't release an egg.
That makes sense. It's like nature's way of helping us not to have too many kids. I love nature.
That's a great way of thinking about it. Can you tell me what you know about ovulation?
Well, I did know that ovulation is when you can get pregnant and you can't get pregnant the rest of the time.
Exactly. And when you get your period, it means that 2 weeks prior, your ovary's been back at work putting out eggs.
Which means you can get pregnant. Interesting. Okay, so let's talk about how I can not get pregnant after that happens.
So, do you have a sense of what's important to you in a birth control method?
Well, I'd still be nursing, and I won't take a pill or a shot or anything like that while my baby's drinking my milk. They say that's fine, but that's not fine with me.
It seems like not using something with hormones would be very important to you. And the most effective method that doesn't have hormones is the copper IUD.
No, I've heard about those. I don't want anything or anyone messing with me inside. Sammy will just use condoms if I tell him he has to.
Okay, so it seems like it would be important for you to have a method that you can manage or control yourself. Is that right?
Well, yeah.
Okay. And remind me, your periods are regular every month when you're not pregnant?
Yeah, every 30 days.
Okay. So let's talk about this method, which is called fertility awareness. Fertility awareness tells you when you might be most at risk for pregnancy and when you're not. Some people also call this natural family planning.
Okay, that's what I'm talking about. Mother Nature.
Yeah, it's all about tracking your periods and ovulation so you can know when not to have sex or when Sammy should use a condom. Seems like that might be something that appeals to you to get to know your body's patterns better.
You know, I love to learn about my own body. And Sammy doesn't love condoms, so if he doesn't have to use them some of the time, that'd be good.
Okay, so there's a lot of different ways to do this. One is this app that helps you track things. And then also there is the lower tech method of cycle beads. We have some classes here that you could come to, or you and Sammy could do them together. So what are your other questions about fertility awareness methods?
So do you think you might like to have children at some point?
Oh yeah, I would love to be a mom someday. But I'm really traditional and family's really important to me. I want to be married first, and I don't really see that happening anytime soon.
How important is it to you to prevent pregnancy until you're married?
It's really important. But, things happen for reasons, so if it happens, I'll deal with it.
So since you've said you don't want to be pregnant anytime soon, would it be helpful to talk about options for contraception?
Yeah, that sounds great.
Great. Do you have a sense of what's important to you about your birth control?
I'm not sure what you mean.
For example, some birth control methods are more effective than others. They do a better job at protecting you from pregnancy. Some methods have hormones in them and some don't. Some methods will change the way your periods come and others won't. Is any of that important to you?
Yeah, when I was looking at this chart, I was just surprised at how differently they all work. I guess I would want whatever works best.
So you really like something that's great at preventing pregnancy until you're married. Do you have a sense of what else you're looking for?
Something natural, without hormones.
I hear that a lot, and different people have a variety of different things that are concerning to them about hormones, and I'm wondering, can you help me understand what's concerning to you about hormones?
I don't want anything that'll disrupt my body's natural rhythms. I try to take care of myself, and I just don't want to put anything unnatural in my body.
It sounds like you'd really be more comfortable with something that's hormone-free.
Yes. I mean, so far, I've been using condoms, but I don't really like how they feel. I mean, when I first start dating somebody, we'll use them until we get tested. I know it's really important to protect against STDs.
Yeah, condoms are a wonderful way to protect yourself against sexually transmitted diseases. And it's an example of what you were talking about taking really good care of yourself, that you're so responsible about getting tested.
Been doing pretty good so far.
So it looks like you're looking for a method that has no hormones and that's really reliable. Do I have that right?
Yes, and that's natural.
Right. Thank you for clarifying. And when you say natural...
Well, like you said, some birth control changes your periods, and I like getting my period. I mean, I like knowing what's going on with my body. So, just being natural.
Well, this IUD contains no hormones, and as you can see, it's up here at the top of this chart that you were looking at. So it's one of the most effective methods that we have. This is what it looks and feels like.
But don't these mess with your ability to get pregnant later? I thought I read that online somewhere.
I think what you're talking about is the shot. And it could take a while for somebody's natural ability to get pregnant to come back after they stop using the shot.
I read a lot, sometimes too much.
While I'm thinking about it, there's a website that I think you might really love. Since you like to look things up and you like to keep yourself informed, it's called bedsider.org. And it's all about contraception, and the information on there is all accurate. And it's really actually very fun. This chart that you've been looking at comes from that website.
Oh, great. Well, thanks. I'll check it out.
Yeah, let me know what you think. And just to be clear, all the other methods of birth control, except the shot, once you stop using them, your ability to get pregnant goes back to whatever's normal for you immediately. So you've been really clear that you want to be a mom someday, but that it's important to you not to get pregnant until then. And this IUD will work for up to 10 years. But if you'd like to get pregnant at any point before that, or if you'd like it out for any reason, just come in and we'll take it out for you. And then your ability to get pregnant will go back to whatever's normal for you immediately.
Oh, I really hope I don't need it for 10 years. I want to be married before then.
Just as long as you know that you can use it as little or as much time as you like, up to 10 years. I imagine you'd like to hear about side effects?
Please, this sounds too good to be true.
So because this copper IUD has no hormones in it, as we said, women will continue to get their natural period, just like they would if they weren't using any birth control. Some women may have heavier periods or longer periods or have more cramps. What are your periods like now?
They're normal, I guess. Sometimes I have to use a heating pad, and that helps.
And you've been pretty clear you don't want to use any hormones. And I'm just wondering if you would be uncomfortable using medication if you got a headache or pain of some kind?
I mean, if I need to, I'll take a leave. Not the name brand, the generic kind.
That medication, generic Aleve, is called naproxen sodium. And actually, if you use it when you get your period, when you're using the copper IUD, it can reduce the amount of bleeding that you get by more than half. Do you usually know when your periods are coming on?
Yeah. A couple days before, I'll get a backache, and so that's why I use the heating pad. And my breasts get really heavy and sore.
That sounds uncomfortable. So the medication that we're talking about actually can also help with your backache and any cramping that you get.
Oh, that's even better.
So if you want to try this, then what I would suggest is when your period's coming on, and you know that your period's coming on, you can feel your backache, start taking the naproxen sodium. On the package, it'll say 1 tablet in the morning, 1 in the evening with food. Just double that, 2 in the morning and 2 in the evening.
Okay, got it. But is it okay to take that much?
Yeah, actually, that's the prescription dose. And if you prefer, I can write you a prescription.
Oh, actually, that would be great. It would actually be easier and cheaper for me since my prescriptions are paid for.
Great. So we've gone over just a ton of information today, and I want to be sure I've been as clear as I can possibly be and haven't left anything out. Can you tell me how you're going to reduce bleeding when you use the copper IUD?